So when you're deciding on your breast implants, there's lots of decisions to make. One of the most important is whether you want a smooth, a textured, or an in-between implant. The decision making around this is really difficult. There's loads of data, lots of it is very selective in the way it's presented by various companies, and there's no really good decision. All you can do is make the best decision for your own lifestyle options, really. So I'll give you a little history of breast implants. So back in the 80s, we used to have something called a smooth implant. So this glass-like smooth implant was what we used a lot, and these created quite a lot of capsular contracture in the past. So the breast would go quite hard, and you'd need a capsulectomy, remove the implant and replace it. Now, this is obviously extra operations. So back in the 80s, a lot of the scientists came up with the idea of using a texture on the implant because the texture reduces the amount of scar tissue and capsule around the implant. And you can see it's quite grainy and it looks quite opaque when you look at the implant. So these textured implants were great because they did actually reduce capsular contracture, and that was a great benefit, meaning women needed fewer operations further apart. The downside is that nowadays we've found out that about 30 years later there is a very rare cancer associated with it called BIA-ALCL, and it has an incomprehensibly long name, and it's not breast cancer, but it's a cancer that forms around the implant in the breast. Now, that only seems to be associated with these textured implants, and there are no cases published with the smooth implants. So your decision making now revolves around, well, do I have fewer operations but a 1 in 15,000 risk of this BIA-ALCL, or do I go for a smooth implant where I might need more operations over my lifetime but theoretically no risk of BIA-ALCL?